Let me be upfront with you about something. If you're over 50 and you've never thought seriously about your prostate health, today is the day that changes. I'm not here to make you uncomfortable or embarrassed. I'm here because this is one of the most important conversations a man can have, and almost nobody is having it openly and honestly. So let's fix that right now. Here's what I want you to think about. Your prostate has been quietly working for your entire adult life. It's about the size of a walnut, sitting right below your bladder, and it plays a critical role in your reproductive health, your urinary function, and your overall quality of life. And here's the thing most men don't realize: what you do or don't do in the bedroom can have a very real, very measurable impact on whether that little gland stays healthy as you age. I'm talking about ejaculation frequency, how often you ejaculate. And before you roll your eyes or click away, I want you to understand that this isn't a taboo topic. It's a medical one, backed by real science, and it deserves your full attention. So, before we go any further, I want to ask you something. How often do you actually think about your prostate health? Have you ever even had a conversation with your doctor about it? Drop your answer in the comments below. Tell me how old you are and whether this is something you've taken seriously before, or whether today is the first time it's really crossed your mind. I read the comments and I genuinely want to know where you're starting from, because that helps me make better content for you. Now, let's get into it, and I promise you, by the end of this, you're going to walk away with a clear, practical understanding of what the research actually says, what it means for your daily life, and what you can do starting today to take better care of one of the most overlooked parts of your body. Let me start by telling you why this matters so much after the age of 50. When you're in your 20s and 30s, your body is running at peak efficiency in a lot of ways. Your hormone levels are balanced, your tissues are resilient, and your prostate, while present, isn't usually a major concern. But as you cross into your 40s and especially your 50s, things begin to shift. Testosterone levels start to decline. The prostate begins to enlarge naturally in most men, a condition called benign prostatic hyperplasia, or BPH. And the risk of prostate cancer, the second most common cancer in men worldwide, starts to climb steadily. By the time a man reaches 50, the conversation about prostate health isn't optional anymore. It's essential. And here's where ejaculation frequency enters the picture in a way that's both fascinating and genuinely useful. Your prostate gland produces a significant portion of the fluid in semen. Every time you ejaculate, that fluid is expelled from the body. This process essentially flushes the prostate ducts, clearing out old secretions, cellular debris, and potentially harmful substances that can accumulate over time. Think of it like this: if you have a pipe carrying water and you stop running water through it for a long time, things can start to build up inside. The same principle, in a very general sense, applies to your prostate. Now I want to walk you through the actual science here, because I'm not going to just tell you to take my word for it. There are real studies that have examined this question, and the results are striking. One of the most significant pieces of research on this topic was published in the journal European Urology. In that study, researchers followed nearly 32,000 men over an 18-year period. That is a massive, long-term study. And they found that men who ejaculated more frequently had a meaningfully lower risk of prostate cancer compared to men who ejaculated less frequently. Specifically, men who ejaculated 21 or more times per month had a significantly lower risk of prostate cancer than men who ejaculated 4 to 7 times per month. Now, let me be very clear here, because I don't want you to walk away with a misunderstanding. That doesn't mean you need to hit some magic number every single month, or that anything below that number is dangerous. The research is showing a pattern and an association, not a perfect formula. Your overall health, your genetics, your diet, your exercise habits, your stress levels, all of these things matter enormously. But what this research does tell us is that regular ejaculation is not just a pleasure or a lifestyle choice. It appears to have a real, measurable, protective function when it comes to prostate health. And this isn't just one study. Other research has supported similar findings. A study from the Harvard T.H. Chan School of Public Health found consistent results linking higher ejaculation frequency with reduced prostate cancer risk. Researchers believe several mechanisms may explain this connection. One theory is the prostate stagnation hypothesis, essentially the idea I mentioned earlier about regular flushing of the gland preventing the buildup of carcinogens or inflammatory compounds. Another theory involves the role of sexual activity in reducing psychological stress, because chronic stress has well documented negative effects on immune function and cellular health. And there's also the hormonal angle. Regular sexual activity helps maintain a healthier hormonal balance, which in turn supports prostate tissue health. Now, here's the question I know is sitting in your mind right now, okay? But what number should I actually be aiming for? And I want to give you an honest, grounded answer to that. Based on the available research, the range that appears to be associated with protective benefits is somewhere in the neighborhood of 15 to 21 or more ejaculations per month. That works out to roughly every other day or slightly more often. But I want to be real with you. For many men over 50, that might sound like a lot, and for others, it might sound completely reasonable. The point is not to stress yourself out trying to hit an arbitrary number. The point is that regular, consistent sexual activity, whether with a partner or through masturbation, appears to benefit your prostate, and complete or prolonged abstinence does not appear to be protective. But here's where I need to add some important nuance, because this is not a one size fits all situation. Men over 50 are dealing with a whole range of factors that can influence sexual frequency and function. Erectile dysfunction becomes more common with age. Testosterone levels drop, which can reduce libido. Medications for conditions like high blood pressure, depression, or diabetes can significantly affect sexual desire and function. Relationship dynamics change. Life gets busy and stressful. I understand all of this, and I want you to understand that I'm not here to make you feel like you're failing if your current frequency is lower than what the studies describe as optimal. What I am saying is this: if you've been avoiding sexual activity, or if you've been under the impression that abstaining is somehow better for your prostate, the evidence suggests otherwise. And if you're experiencing issues that are making sexual activity difficult, things like erectile dysfunction, low libido, or pain, those are issues worth talking to your doctor about, not just for the sake of your sex life, but for the sake of your prostate health and your overall well being. Let me talk for a moment about what's actually happening inside your prostate as you age, because I think understanding the biology helps everything else make more sense. The prostate sits at a crossroads in your body. Urine passes through the urethra, which runs right through the center of the prostate. Semen passes through during ejaculation. This gland is surrounded by nerves that control bladder function and erectile function. As the prostate enlarges with age, and again, this happens in the majority of men to some degree, it can begin to squeeze the urethra and cause symptoms like difficulty urinating, a weak urine stream, the sensation that the bladder isn't fully emptying, or needing to urinate frequently, especially at night. These symptoms are collectively known as lower urinary tract symptoms, and they are incredibly common in men over 50. Now, does ejaculation frequency directly prevent BPH? The evidence on that specific question is less definitive than it is for prostate cancer. But what we do know is that the overall health of the prostate, its circulation, its cellular turnover, its hormonal environment, is influenced by regular activity and by the general health habits of the man it lives inside. Staying physically active, eating a prostate supportive diet, staying hydrated, managing stress, getting regular checkups, including PSA testing after 50, and yes, maintaining regular sexual activity. These are all pieces of the same puzzle. I want to stop for a second and acknowledge something that doesn't get talked about enough, which is the emotional and psychological dimension of sexuality after 50. Our culture has a strange and sometimes damaging tendency to treat male sexuality as something that either peaks in youth or should be hidden in age. But that is simply not true, and it is not healthy. Sexual desire, intimacy, and physical expression are normal, healthy parts of human life at every age. Research consistently shows that men who maintain active and satisfying sex lives as they age report higher levels of well being, better mental health, stronger relationships, and yes, better physical health outcomes. The idea that men over 50 should somehow dial back or be embarrassed by their sexual health is not just wrong, it's actually harmful. I want you to hear that clearly. Now, let me address something practical. because I know a lot of you are watching this and thinking about situations that aren't perfectly straightforward. Some of you are in relationships where sexual frequency is a negotiated thing, and I hear you. Communication with your partner about sexual needs and health is so important, and if you're in a partnership, this video might actually be something worth watching together or discussing together. Your prostate health is a shared concern in a relationship, just as your partner's health is your shared concern. Some of you are single, and there may be feelings of shame or awkwardness around the topic of masturbation as a means of maintaining ejaculation frequency. I want to be completely direct with you. Masturbation is a normal, healthy activity. For men without regular partners, it is a perfectly legitimate way to maintain the kind of ejaculation frequency that the research associates with prostate health benefits. There is nothing to be embarrassed about here. We're adults talking about health. And if your doctor hasn't mentioned this to you, it might simply be because these conversations don't always happen in the 15 minutes of a routine physical. That's why conversations like this one matter. Let me also talk about what else you should be doing for your prostate health, because ejaculation frequency is one piece of the puzzle, not the whole picture. Diet is a big one. Research suggests that a diet rich in tomatoes, particularly cooked tomatoes, which are high in lycopene, may have protective effects on the prostate. Lycopene is a powerful antioxidant that has been studied for its potential role in reducing prostate cancer risk. Green tea contains compounds called catechins that have shown anti inflammatory and potentially anti cancer effects in laboratory studies. Foods rich in zinc, like pumpkin seeds, nuts, and legumes, support prostate function because the prostate contains some of the highest concentrations of zinc in the body. And cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that support healthy cellular processes throughout the body, including in prostate tissue. On the flip side, there are dietary patterns that appear to increase prostate health risks. High consumption of red meat and processed meats has been associated with higher prostate cancer risk in some studies. Excessive dairy consumption has also been flagged in certain research. Diets high in refined sugars and processed foods contribute to chronic inflammation, which is a driver of cellular damage throughout the body. I'm not telling you to never eat a steak again. I'm telling you that what you put in your body every day, over the course of years and decades, adds up to something significant. Exercise is another pillar of prostate health that I can't skip over. Regular physical activity, and I mean at least 150 minutes of moderate intensity activity per week, which is the recommendation from most major health organizations, has been associated with a lower risk of BPH symptoms, a lower risk of aggressive prostate cancer, and better outcomes for men who do receive a prostate cancer diagnosis. Exercise helps regulate hormones, reduces inflammation, supports a healthy weight, and improves circulation, all of which matter for the health of your prostate and your entire body. Speaking of weight, there is a meaningful connection between obesity and prostate health that often gets overlooked. Men who are significantly overweight, particularly those carrying excess fat around the abdomen, tend to have higher levels of estrogen relative to testosterone, which can negatively affect prostate tissue. Obesity is also linked to higher levels of systemic inflammation and insulin resistance, both of which have been connected to increased cancer risk. I'm not here to body shame anyone. I'm here to tell you that achieving and maintaining a healthy body weight is genuinely one of the most powerful things you can do for your prostate, among many other aspects of your health. Now, I want to talk about something that many men dread, but that is honestly one of the most important things I'm going to say in this entire video: regular prostate screenings. Starting at age 50 or at age 40 to 45, if you have a family history of prostate cancer or if you are of African descent, which carries a statistically higher risk, you should be having a conversation with your doctor about PSA testing. PSA stands for prostate specific antigen. It's a protein produced by the prostate gland, and elevated or rapidly rising levels in your blood can be an early indicator of prostate issues, including cancer. I know the idea of PSA testing has some controversy around it. There have been debates in the medical community about overdiagnosis and overtreatment, and those are real, valid concerns. But the bottom line is this: having that conversation with your doctor, understanding your baseline PSA level, and monitoring it over time gives you information. Information gives you options. And catching prostate issues early, when they are most treatable, is far better than finding out late. Please do not skip this. Please do not let fear or embarrassment keep you out of your doctor's office. Your life is worth a blood test and a conversation. The digital rectal exam, or DIRI, is another screening tool that some doctors still use alongside PSA testing. I know it's not anyone's favorite topic, but it takes less than a minute and it allows a physician to feel the prostate directly for any abnormalities in size, shape, or texture. Men often avoid talking about this or even thinking about it, but discomfort lasting a few seconds is a small price to pay for peace of mind about your health. Let me bring this back to where we started, because I want to tie everything together for you in a way that's practical and actionable. You are over 50. Your prostate is aging, just like the rest of you. That doesn't mean you're headed toward disease or decline, it means you need to be paying attention and making intentional choices. The research tells us that regular ejaculation, somewhere in the range of 15 to 21 or more times per month, is associated with meaningfully lower prostate cancer risk. That's not a prescription, it's a finding, and it points toward regular sexual activity being genuinely beneficial for your body. Pair that with a diet rich in plant foods, antioxidants, and anti inflammatory nutrients. Exercise consistently. Maintain a healthy weight. Manage your stress. Stay hydrated. Limit alcohol and processed foods. And for the love of your own life, go see your doctor and have an honest conversation about prostate screening. I also want to say this directly to you. If you have been experiencing any symptoms that concern you, difficulty urinating, pain or discomfort in the pelvic area, blood in your urine or semen, painful ejaculation, or any other change you've noticed, please don't wait. These symptoms can have many causes, some benign and some more serious, but the only way to know is to get evaluated. The earlier any issue is caught, the more options you have. Don't let embarrassment steal years from your life. I also want to acknowledge that some of you watching this may already be dealing with a prostate diagnosis, whether that's BPH, prostatitis, or even prostate cancer at some stage. If that's you, I want you to know that this content is made with you in mind too. The lifestyle factors we've discussed, diet, exercise, weight management, stress reduction, regular sexual activity where appropriate and possible, these things matter for men at every stage of the health spectrum. Even for men going through treatment for prostate cancer, research suggests that maintaining quality of life through healthy habits and, where appropriate, sexual activity can have positive effects on recovery, well being, and long term outcomes. Talk to your oncologist or urologist about what's right for your specific situation. And for those of you who are watching proactively, who haven't had any major prostate issues and are simply here because you want to stay that way, I want to tell you that you're making one of the best possible investments you can make. Prevention is always better than treatment. The habits you build today, the conversations you have with your doctor this year, the choices you make at the grocery store and the gym and in your intimate life, they are quietly building either resilience or vulnerability in your body every single day. You have more power over your prostate health than you might realize. I'll leave you with this thought. There's something almost poetic about the fact that one of the ways you can protect your prostate health is by embracing intimacy, connection, and the pleasure that comes with a healthy sex life. So much of men's health advice feels like deprivation. Stop eating this, stop doing that, exercise more, sleep more, stress less. And while all of that is valid, here is a piece of health guidance that says yes, stay connected, stay intimate, stay engaged with your body and the people you love. That's not a bad prescription. That's actually a pretty good life. Take care of your prostate. Take care of yourself. And if this video helped you in any way, or if it raised questions you didn't have answers to before, please share it with the men in your life who need to hear it. Drop a comment below telling me what was most useful for you, what questions you still have, or even just telling me that you're going to finally make that doctor's appointment you've been putting off. I'll be right here and I'll keep making content like this because your health matters and you deserve to have all the information you need to protect it.